Okay, I think we're ready to start. Welcome everyone to this very special occasion. This is a webinar part of the Client Connect series with Eccovia. Client Connect is Eccovia's attempt to um, connect communities together that want to learn best practices from each other so they can share their processes, documentation, technology techniques, and of course, encouragement. The Atlanta Continuum of Care, or COC, follows the housing first approach, and they are led by the organization Partners for Home, which partners with the Institute for Community Alliances. Now, why are we doing this webinar now? Why is coordinated entry such a hot topic? Well, part of that is because Grants Pass v. Johnson, a potentially landmark decision from the Supreme Court of the United States, has opened up some, well, charitably speaking, some ambiguity as to whether municipalities will be able to essentially criminalize some aspects of homelessness, including camping in public spaces. So now more than ever, communities need better solutions for coordinating care. So I am your host today. My name is Bryce Peterson. I am the Marketing Communications Manager here at Eccovia, and we will be joined by a team of experts from Partners for Home and from ICA. So let's meet our presenters. First up, we have Camille Sims. Camille joined Partners for Home in April 2024 as Director of Coordinated Entry, Outreach, and Diversion. And she is responsible for strategic development and direction of the coordinated entry system, ensuring a highly coordinated homeless crisis response system, and also builds relationships to deliver a system that results in making homelessness rare, brief, and non-recurring, or as we like to call it, functional zero. Prior to joining Partners for Home, Camille worked in Atlanta's food security community and in childhood development in New York City. So she has designed and led community-based programs that mitigated barriers, mitigated barriers to food security, employment, healthcare, housing, and literacy. Um, After that, we have Abby Burgess. Abby Burgess is a special project manager for ICA. She has over 20 years experience as a homeless services program manager, system admin, and technical trainer. She's also experienced in interpreting and implementing federal, state, and local policy and grant requirements. Abby has also provided leadership in various positions at the local level, including roles as a COC board member and active task force participant in several states, and as technically trained system administrators in communities in more than 30 states. Throughout her career, Abby has assisted communities with evaluating the quality of their HMIS data, an issue I'm sure you're all familiar with, developing business processes to implement coordinated entry and HMIS, and engaging providers to participate more fully in HMIS. Sheena Luton is an HMIS manager from ICA as well. She has worked with ICA, the Institute for Community Alliances, for more than 4 years. She began her work as a system admin and now serves as HMIS manager. In her work at ICA, she provides technical assistance and trainings like webinars, like what we're doing right now, as well as project management, and helps refine coordinated entry. Sheena has worked in homeless services for over 8 years, holding many positions at a local organization providing supportive housing and direct client services, as well as working for the local county government in Atlanta. Sheena holds a master's degree in community development from North Dakota State University. She has successfully built many relationships with local continua of care, local coalitions, and partnering agencies serving the homeless populations throughout Georgia. And then finally, we have Paisley Stewart. Paisley joined Partners for Home team as the coordinated entry project manager. In this role, they maintain the coordinated entry system, facilitate coordinated entry refinement, lead system navigation work, and provide training and technical assistance and coordinate efforts related to ending chronic homelessness. Whew, that's quite a list there, Paisley. Paisley previously worked for the Athens-Clarke County Housing and Community Development Department, overseeing the local continuum of care program and managed community development block grant projects. They also have direct client service experience as a case manager, working with HIV positive individuals and individuals experiencing homelessness. So, without further ado, uh, I will go off camera and hand this off to Camille Sims. And Camille, if you wouldn't mind turning on your camera and tell us what we're going to learn today.
Great. Thank you so much. It's wonderful to be here with everyone. Thank you for that wonderful introduction. Today we're going to go over 5 key sections. The first one is our CE system vision and values. We have the CE history, the build out and lessons learned from and workflow. The next is governance of HMIS administration. Number 4, where technology and CE connect. And then last but certainly not least, the future of our CE system here in Atlanta. So I'm going to talk a little bit about our CE system vision and values first. So our vision for how Atlanta ends homelessness is really grounded in people experiencing homelessness or at risk of homelessness will first receive emergency assistance through 2 ways: outreach or overnight shelter. Next, they'll be assessed through a coordinated entry assessment, assigned a case manager, and then navigated through our system for relevant services they may need. We know using a coordinated and standard process to one of the 4 interventions will end their homelessness. The 4 interventions are diversion, income and employment, rapid rehousing, and then permanent supportive housing. The values that ground our CE system are trauma-informed, client-centered, efficiency, harm reduction, equality, and housing first principles. I'm going to pass it to Abby Burgess to share our next section.
Hi, everyone. Thanks so much. I'm going to go over some of the history of Atlanta's coordinated entry system. Before I dive into that, I'm looking at the participants on the call, and I do need to give a shout out to the Georgia HMIS staff and other COC administrators that are on the call. I wish I could see all of your faces. Some of you were here when this timeline started, or some of you were in Georgia before ICA partnered with Partners for Home on this adventure. And so I'm taking a walk way back, starting my timeline to when you all worked with Atlanta and Eccovia to design the original coordinated entry custom build out. At that time, Atlanta and Fulton County also worked and partnered to make some shared visions for a common coordinated entry system. And again, this is 2016, 2017. So the system design was created with what I came into Partners for Home, what we inherited in 2019, which was this really rich coordinated entry, full end-to-end, I kind of call it, closed loop referral system in Client Track. And I was blown away by the system that Atlanta conceptualized and that GIHMIS and Eccovia built. I'd never seen anything like it in HMIS, or hadn't seen anyone do anything this unique at the time. In Atlanta, their coordinated entry system includes, as Camille said, both emergency access and which we call short-term, and then long-term referrals to permanent housing. And in the design, it's role-based, and so each role has there's a provider workflow, there's an assessor workflow, and then there's CE management and matchmaker workflows and different roles in the implementation. So all of this system was designed, it was just getting up and running. We were working on making sure that end users knew how to use the system, and we were doing housing matching. And then, of course, we all remember the 2020 data standards release. And I think that slide says 22, but it was 20, the original coordinated entry data standards. So Eccovia was working to build their framework for these new data standards that HUD put forward. I think all vendors and all communities were working on this together, but it didn't exist yet. And so GAHMIS had to sort of retrofit this, what Catherine Vassal calls Cadillac of coordinated entry, to meet the needs of the data standards. So ICA had the pleasure of working on that with the Georgia HMIS team, with Eccovia, and with Partners for Home. Once we got the new design, then our team deployed coordinated entry, those role-based trainings. We leveraged the GAHMIS Talent LMS system. So we had recorded trainings to provide consistency for all of the individuals that were utilizing coordinated entry, which vastly improved the use of the system. We also, Georgia HMIS and the state moved to an informed consent policy. So we had some changes in coordinated entry, how, where we used to we just had to change the way that our release of information worked in the database when that was implemented. And then we felt confident enough to put a public dashboard up. Partners for Home and their steering committee approved the performance metrics, and we were displaying project level performance for permanent housing projects. We were looking at returns to homelessness. We were looking at exits to permanent housing, and they had benchmarks across the community that their performance team and committees in the community put together and publicly displayed those metrics. When we began really granularly doing housing matches, as all the COVID money came in and as all these new projects were coming in, we found the need. We needed to build out some pretty fast, fancy slicers, what I call them. We use Power BI to build what we call the QAT, which is the Q analysis tool. As the system was planning for what housing resources they needed, we just found the need to have to, just do so much slicing on the existing housing queue. And there were thousands of people on the housing queue that we had to sort through and figure out what is the right intervention going to be and how are we going to tag folks into the best path forward to housing for them. So pretty fancy kind of dashboard. I think Paisley will share a pic of that in a minute. And then finally, 23, 24, we had C management transition. Paisley joined the team from, I believe, Athens is what we just said. And we did a huge housing queue cleanup, getting folks exited that no longer needed services. And we went into full refinement. So I'm going to talk a little bit about those. We can go to the next slide and just kind of we've done, now 3 iterations, I would say, of coordinated entry. You just have a couple of build out lessons learned, and then I'm going to quickly show you a couple of workflow things and tools that we used. What we learned was that the original workflow was too restrictive. If an end user didn't correctly select the right thing in the prompt, it was conditionally formatted and it goofed up the whole workflow. So we found we were troubleshooting our process and that it was locked down too tightly. So we learned that and tried to sort of loosen up any areas where we could prevent a user from, not getting somebody on the housing queue, because that was the goal. We also realized that we had some metadata that were missing for different status changes. We wanted to do some reporting on, when between this and this happening. And we weren't able to do that as granularly as we thought, because in the design, we hadn't thought to put date stamps and changes in certain places. We also ended up kind of out of scope in 2020 for our business requirements. We were trying to get into compliance, and we had all of these ideas about vacancy management and reporting that we could do within the application, and we just couldn't get it in scope due to the lift that the HUD data standards required us to do. And then lack of process documentation. And I'll show you what we ended up with here if we want to go ahead and go to the next slide. But documentation is key. You all know this. If we don't document our work, it makes it very difficult to make changes in the future. So this is what I think probably a pretty typical kind of coordinated entry workflow. I don't know that all systems have vacancy management on the provider side embedded within their housing queues, but essentially you come into coordinated entry and you go to shelter or you go to the housing queue and then you get your referral and offer and your placement and the housing matches occur. This is really simplistic, but if we go to the next slide, what actually is happening to folks and their journeys on the ground and the screening and the referrals and the different things we were doing looks a little bit more like this. So again, we have the access to coordinated entry, but then we have prevention and diversion, and we have all of our front end initiatives that need to be handled before somebody makes their way to the housing queue. We were trying to figure out the appropriate intervention, so we had to start to try to build in that prevention and diversion into the front end. And I'm sure that that's not a unique concept to Atlanta, but it was part of our huge refinement process that we went through. We also wanted to consider VA, and then, we did a safety screening for domestic violence. So once folks got on the housing queue, then we kind of went through all of the steps on the second half. And you can see all of the tools that are available to the CE manager. They can, they can do those shelter referrals. They can do work on prioritization. They can make those longer term referrals. And then, at the end of all of it, the goal was to get folks exited off of the by name list when they received housing. I'm going to pause for just a moment. Yes, Daniel, the Atlanta system had a kind of a dual housing queue situation happening, and we actually that was in the original build out, was that you needed to be able to be on the housing queue, referred to emergency shelter if you needed it, be in an emergency shelter facility, but then also have the ability to be referred into the long-term housing solutions. So that's a great question. Let's go on to the next slide. I just want to show you a couple of things that ended up getting developed out of our refinements and our work together. We needed to create a common language between our technical team and the community. And so we ended up building out documentation that included client track specific design tool language, right? So we had to get, form IDs and work group overrides and build out the business requirements in that technical language, because we had so many work groups and so many forms and so many overrides that we really just had to get really granular and say, okay, what are we doing here? And which one is this? And what do we call that? And where is it at? So you can grab this when the slide deck is published. This is available. And then also on the next slide is our dictionary. So we did create a dictionary for coordinated entry as well. And that's just showing the different fields that are used and what they're used for. And there's a little, we created a legend on, whether it was required, whether it changed based on which workflow it was in. And so this one's got multiple tabs on it, but just offering it to y'all as the resource that really helped us to wrap our heads around what we had at our fingertips in the system, and what we were able to the tools that we were able to use then to move the refinements forward. So really cool work. Again, shout out to GAHMIS, Eccovia, Partners for Home. Really, really neat stuff with these different iterations and builds. I'm going to pass it to Sheena to discuss some of our governance.
Thanks, Abby.
I apologize for the typo of your name there.
No worries. So yeah, so looking at our governance structure, our training is streamlined through a smart sheet approval tracking method. So any end user that is seeking CE assessor or provider work group access would submit a request through a smart sheet form, and the CE manager would approve that end user's request to access that specific training course. All of our Atlanta CE training courses are on the Talent LMS platform, and the users are to complete that. Once the end user has completed the training, a CLC admin will update the Smartsheet form noting that the training has been completed, as well as going ahead and getting those end users workgroup access in HMIS. So looking into our access and development partnership, we have monthly CE workgroup trainings that are held for assessors and providers, and they're required to attend in order to maintain their access. The monthly meetings go over common issues made by users, conducting live walkthroughs of certain assessments in the workflows, and any policy and system updates. The CE manager manages active list of all CE workgroup users and send out any CE communications via email. All of our training guides consist of step-by-step instructions and screenshots on conducting enrollments and completing other CE functions that are provided to all end users that are of those specific CE work groups. And these guides are available for reference in the resource section of the webinar. We always, not yet, I'm sorry. We always want our end users to be comfortable in the CE work group. So as a part of training and conducting test enrollments, end users can have access to the HMIS training site as well as our recordings of the monthly CE trainings for reference. And through our CE refinements committee, which meets monthly, we get the opportunity to develop the partnership and hear from our community partners to express concerns, ways to improve our coordinated entry systems, as well as what is working and what isn't working. And this group consists of outreach workers, our DV providers, shelter providers, and youth and SSVF providers. Next slide. So currently the system has an implied consent data sharing agreement for clients being enrolled into programs. So for those clients that choose to restrict their data sharing, they will complete a data sharing opt-out form. Clients with the restricted release of information, those referrals are handled manually between assessors, the CE manager, and the providers. So an assessor must communicate the client's details to the CE manager or to that referring provider. This is also the case for our DV clients. So vacancies that are filled by these clients are taken offline, so they aren't shown as available to be referred into. And the CE manager is responsible for taking the unit offline and will make note of the client ID, initials, and the date that the client checked into that vacancy. The CE manager will also be responsible for bringing that unit back online once the client has checked out or discharged from the vacancy. Our coordinated entry system also allows for users to gain read-only CE assessor access in certain circumstances. And so for these purposes, it could be assessing required documentation for specific projects and also ensuring compliance within the programs. These end users must complete a read-only access agreement form and the necessary training in Talent LMS before accessing the system. And I will turn it over to Paisley.
Thank you, Sheena. Thanks, Abby. Thanks, Bryce. I'm going to talk a little bit more about our coordinated entry processes, what it looks like on the ground working with those CE assessors, our providers, as our CE manager. And before I dive into those processes a little bit further and connect that back to HMIS, I want to talk about those roles in a little bit more depth. So as is noted, our CE assessors are really the ones who they manage our CE access points. They're the folks who are going to be completing assessments and providing case management. We'll talk about what that looks like in the next few slides. And then our CE providers, as Abby highlighted, our system really focuses on the ability to have that vacancy management within HMIS. So our CE providers are those permanent housing providers who are adding all of their vacancies in the system, managing those vacancies, receiving those referrals, and working to get those clients housed. So as the CE manager, I always say that we kind of act as the bridge between those assessors and those providers, making sure that we're doing the matching and the referrals and managing the technical aspects of the system as well. So I'll dive a little bit more now into the access piece of our CE system. So Atlanta does operate a multi-access point model. We do have options for telephonic access points. We also have mobile assessors and street outreach, as well as a primary centralized access point, as well as currently developing some more site-based access points. And we have explored options for subpopulation specific access. We know that HUD does allow this for certain special populations, and so far have created a number of youth-specific access points in coordination with our YHDP efforts and our senior project manager of special populations. Something I want to highlight on the access end is that our HMIS workflows include prompts and scripting based on clients' responses. And this is something that we look to continue to refine and add as more resources become available. But two great examples of this are, as Abby mentioned, that looking for folks who are fleeing domestic violence and prompting those connection to the DV access points if people prefer. And also that there are in HMIs that will prompt diversion referrals for folks that meet what has been the criteria for those who are most successful with diversion. Diversion is available for all folks on our housing queue, but we do look at it especially for those who it is their first time experiencing homelessness, who have income and who may be able to quickly, rapidly exit homelessness from diversion. So moving on to assessment, once folks have accessed a coordinated entry access point, we are using the VSPADAT as our assessment tool at this time. Want to highlight here that we do really focus on those assessors keeping their assessments up to date, knowing it directly affects folks' prioritization. So those can be updated every 6 months or more often as needed if things have changed, or as we know, folks sometimes learn more about the individuals they're working with. And then immediately they are assessed for those emergency needs. And as is stated, we do have emergency shelter vacancies within the system, so folks can quickly be connected to those emergency shelter beds. And then in general, our assessors are trained in assessing for folks what needs and barriers they have and connecting them to community-based resources. One thing I wanted to specifically highlight here is our Atlanta 311 telephonic access point. So this is a phone line now operated by the city of Atlanta, and they operate as kind of a non-traditional CE access point. So instead of providing that full CE assessment access, they do gather clients' initial data and then assess for if that client can be referred to diversion or into navigation and added to the housing queue. And so this is a way that folks can more quickly access coordinated entry, and that we can utilize this hotline by still connecting folks then with our community partners on the ground and getting folks rapidly connected to resources. And I know that did take quite a bit of work on the HMIS side to build out those referrals and connection pieces as well as reports that allow us to monitor those. Going to go ahead and go on to the next slide here. I'm not going to go in depth into our housing navigation program model, but I do want to highlight it because it is really central to how we view case management for folks engaging in coordinated entry and how we navigate them through the CE process and into housing. So this was updated most recently in 2023 with our CE Refinement Committee. We got feedback from our Client Advisory Council, which is our committee of folks with lived expertise, as well as from others in the community. But this really looks at what does the elements of housing navigation, and I'll let you all dive into those more deeply, look like for folks. It also, on the next slide, if we go there, outlines the population that receives housing navigation and the desired outcomes, as well as performance indicators and the time frame for this. One thing I want to note is that we do provide weekly system navigation meetings. So these meetings are led by the CE manager or myself. And here we are really able to kind of case conference and dive deep into the housing needs and solutions for individual folks. One struggle that we have, as I know many COCs have, is the capacity to provide this level of navigation to all individuals on their housing queue. So you'll note that in that population piece, this is actually one of the areas we really expanded in 2023, but we do have a prioritization for those who are chronically homeless as we work to expand our pool of housing navigators to provide this level of case management. Okay, can go on to the next slide. So once folks have been accessed the system, they've been assessed, they are now on the housing queue. The focus really falls now onto the CE manager to prioritize folks based on our prioritization policies and the available vacancies. I did want to highlight what our prioritization policies are. We prioritize folks for permanent housing based on the VSBAT score and their total self-reported length of time experiencing homelessness. In our system in City of Atlanta, clients must be document ready to receive that referral. That will depend on what documents that program requires, but that is an important part, you'll note, of the housing navigation program model, as well as our referral process. For permanent supportive housing, we prioritize those who are chronically homeless with a VSBAT score of 11 plus, and then we prioritize those for rapid rehousing who have a VSBAT of 4 plus. As I mentioned, diversion is available for all folks on the housing queue and would be available for those who fall outside of that 4 plus range for rapid rehousing. However, we have also utilized rapid rehousing with folks who have a range of VSBAT score, a range of situations. So it's something that we've really integrated throughout our system. Abby spoke a little bit about the Q analysis tool, but something we have done is put a lot of work into two main sets of prioritization tools, the QAT, and then there's been a lot of work on building out those special population specific by name list. So we have by name list for every special population in our system. For us, we view that as chronically homeless individuals and families, families as a whole, youth and veterans. We've built out very elaborate dashboards for youth and veterans and are excited to expand that to families and chronics in the future. But those are utilized to really manage that population specific needs. And then I'll speak more about the QAT on the following, on the next slide. I do want to highlight again kind of some of these areas where HMIS and coordinated entry intersect. Sorry, if you want to just go back for a minute, Bryce. One of the items I think is a great example of this is managing chronic homeless data. So some of the cool things we've done around this is knowing that chronic homeless status, one, involves a number of different data elements to pull together. It is very easy for CE assessors to make errors or for clients to not correctly report their length of time homeless or other information. So we found it's very important through training as well as HMIS tools to manage kind of this chronic homeless piece. To ensure that folks are getting connected to all potential housing options for them. One of the things we have done is build this into the QAT. I'll highlight that a little further, but we've also ensured that it is built into the client's dashboards in HMIS as well as the housing queue so that those assessors and myself as the manager can very easily ensure it's correct and updated as needed, as well as provided some in-depth training and guides on that. Go ahead to the next slide. This is a just snapshot of our Power BI tool, the Q analysis tool. This is kind of the landing page in there. I am not going to go through all the different slicers and dicers. And as Abby was highlighting, we really just found a need for the ability to drill down very specifically, whether it's subpopulation, whether it's what documents folks have uploaded in HMIS. All of these things became very important for us to quickly be able to pull reports in. So you can see here that you're able to multi-select a number of different filters. It's going to give you a summary of the client count, the percent of the client housing queue, as well as the average days and median days on the queue. We also are able to look by those who are in specific shelter programs or connected to specific outreach programs. So that's extremely helpful. And then can easily pull all of this into Excel docs and utilize that for prioritization, utilize that for case conference or other by name list, as well as recording of performance data. So I always say the Q analysis tool is kind of, I don't know, it is the backbone of our prioritization and of the CE manager role in many ways. Okay, we can go on to the next slide. Going through our referral process. So once we've identified those per our prioritization process policies, I do want to highlight what the referral process looks like, kind of in the practicality of it. Obviously, we have those detailed HMIS workflows, but this is what it looks like for the CE assessors and managers for when referrals happen. So again, highlighting that assessors can make those emergency shelter and diversion referrals for clients on the housing queue themselves. We do utilize like kind of a room notes or notes feature on emergency shelter that then provides them with next steps. So they are responsible for coordinating whether that is that they need the client to show up at a specific time, they need to email or call, but they have been reserved in that bed once that referral is made. As we've stated, only the CE manager role within HMIS can make rapid rehousing and permanent supportive housing referrals. We do have some other permanent housing as well, such as vouchers. And once those referrals are made, we do currently still do communication on these referrals outside of HMIS. So the CE manager notifies the assessor and any other case managers connected with that client via email, as well as connects them with the provider on that email. Our HMIS system has, and we do utilize automatic emails for the provider to notify them of referrals. But at this point, we have found that it is most successful and that we have the most positive outcomes when we also initiate this contact outside and really connect the assessors and providers directly via email. The next slide. So after that, within our system, those assessors have 72 hours to offer, accept, or reject that referral in the system. That is not broken down by business hours or non-business, so it is 72 hours point blank. Otherwise, that referral will expire and the new client will then be referred by the CE manager. I will highlight here as the CE manager, we do sometimes offer accept referrals for clients, especially in cases of, like I mentioned, if there's a holiday weekend or something, we don't want that person to miss out on the referral because of that 72-hour window. There's also circumstances where it is necessary just for the management. But typically that is the role of the assessor to go in and offer accept those. Then the assessors and case managers are required to kind of ensure client contact information is up to date. And we also see our assessors and providers work very closely together. So I know some CE systems really focus on that provider reaching out to the client directly. It is really a key part of our system navigation, have it modeled that the case manager and assessors be deeply involved throughout the housing process. And then want to highlight that providers have the ability to both provide or accept a referral inside the housing queue and then can initiate that enrollment, but they can also provide or reject. And particularly, we see this if the client is not reachable or if they're unable to get the necessary paperwork. Our policies outline 72 hours, but we do promote some flexibility depending on the client circumstances there. Next slide. I wanted to highlight just a few more features of our coordinated entry system and how they relate to HMIS. So on the referral and enrollment side, we have a wonderful custom HMIS report that allows us to look at all CE referrals. It provides us in-depth information about the timeline of those referrals, about the status of them and the resulting enrollments that do or do not happen from them. So we can utilize that for referral performance data, look at those by the project level or by project type. It also provides us client level data and demographic data, so we can also see the success of those from that side. In our system, and Abby touched on this, we do have a CE auto exit. So once clients are enrolled into the permanent housing project, they will then be auto exited for coordinated entry. A key piece here that we are always kind of providing data management and training on is that enrollment must be properly connected to the referral for this to all work correctly in the system. So that is a big part of my role, is also making sure that all of these pieces are lining up and working correctly. And then it's really helpful for us that the referral status shows both in the housing queue and the QAT. So assessors and providers can all view the status of that referral within the housing queue, and that QAT report will show us the most recent status from when it was updated as well. And then to touch on vacancy management, I did mention that we have that provider reject feature. These will show on a placement rejection page, which is managed by the CE manager, and all of those must be approved. We then have a report that allows us to see all rejections and really monitor that folks are in compliance with our housing first approach and see what that looks like across our system. Sheena touched on this, that we have offline units. This is super helpful, as Sheena mentioned, for folks who are unable to be referred in coordinated entry via our kind of traditional system. It is also utilized to ensure that vacancies that are showing as available, but maybe they're not ready yet. Let's say there was some damage to the unit, that we can kind of put them offline temporarily and hold them until they're ready to be referred into. And the final feature I want to highlight here is that while we do have that auto exit that occurs when someone is enrolled in coordinated entry, we do not similarly have a feature where that vacancy immediately becomes available upon the client being exited. So instead, we have kind of a two-part process where that provider must exit the client and then also check them out of the vacancy. We do find that this helps with vacancies not incorrectly coming online or being referred into, because they know that they must check that client out before that vacancy comes back on and we refer back into it again. So those are a few of the key features. I'm going to pass it back over to Camille Sims at this point. Thank you.
Thank you, Paisley. There's just some resources here that we've wanted to share with the group. We have our CE assessor training guide, our CE provider training guide, our CE manager training guide, and then a link onto our website of our assistance performance dashboard. So I'm just going to touch on the future of coordinated entry in Atlanta. We've really focused on 4 main areas. First, with access expansion, that's something we've seen that's deeply needed in the city of Atlanta. And so we're working to increase our number of mobile assessors, expand our telephonic assessors through Atlanta 311, to create subpopulation specific accesses for coordinated entry, and then to work on our emergency shelter bed availability to make sure that folks have accurate information to be able to refer individuals. The next item that we're focused on is a VS-FDAT replacement tool. Our CE refinement committee is really spearheading that work, but that's something that we found, as many cities and local cities have really tried to find a replacement for the VS-FDAT. We know that it doesn't capture the whole story, and so we're looking at a number of different options to phase out the VS-FDAT so that we can greater see folks' vulnerability and what the needs are. Our second is just, we have launched a internal HMIS team and expanding that team to better support our CE system. And then lastly, to continue to refine coordinated entry, that looks like our transfer process build out, that looks like continuing to improve our workflows to make sure that we can include case conferencing tools, and then of course, constantly seeking efficiency and refinement for our policies and procedures that are updated throughout the year. I'm going to pass it back to Bryce. Thank you.
Yes, thank you, Camille. Thank you, everyone who's presented so far. Paisley, Abby, Sheena, Camille, of course. Let's give our presenters a big virtual round of applause in the reactions. I know it's not quite as amazing as an in-person applause, but I would love to see if we have some time to field any last-minute questions. We had one. Okay. Yeah, so if you all want to just type in your questions and I'll read them aloud for our presenters. We have one right here. Apologies if I missed this, but how many people total are on the team? HMIS, CE managers, analysis.
Yeah, I can jump in. This is a little bit in flux right now for us, but our team has traditionally been a CE director and one CE manager. So that would be Camille and myself. We also have had one data analyst who works on a number of items, not just coordinated entry, as well as Shannon, you can speak more to this. Our HMI's kind of lead person and a system admin. So those folks don't only support coordinated entry, but are involved. Sheena or Abby, feel free to jump in and add more there.
Yeah, so there's one HMIS manager and two HMIS CLC admins, along with the CE director, CE manager, and data analyst.
Great, thank you. Um, uh, Jackie asks, when people are assessed and enrolled in CE, are they assigned a case manager or connected to the case manager by the assessor?
So this looks a little bit different from organization to organization. Sorry, I'm looking at it. So many of our assessors will function as the client's case manager as well. So that's often true for our street outreach programs. However, with some of our larger kind of site-based or larger CE access points, they may first work with an assessor and then be assigned a different case manager or navigator. So we really try to be flexible to the needs of the organizations who are providing those CE access points and see what is needed for them in their capacity. But it is critical that all folks are assessed and then have that case management service as much as possible. We do like for those to be the same person.
Good, good, good. Ravonda asks, once a client is enrolled in CE, how long are they on the prioritization list slash eligible for referral into a housing project? In follow-up, Jordan asks, are people ever turned away, whether or not they score high enough or are removed for any reason?
Yeah, so folks are able to stay on the housing queue as long as they meet the eligibility, which is just that they're experiencing homelessness within the city of Atlanta, right? What the requirements are for all of our permanent housing projects. Additionally, we do have a requirement for folks to be active, and this is just to have better management over the queue. What that looks like is case managers or assessors do work to contact clients monthly at minimum. Many of them are in contact much more frequently, especially those who are getting that level of navigation service. But if an individual or family is unable to be contacted for 90 days, after multiple attempts, we do exit them from coordinated entry. One thing I will highlight that's a really wonderful feature within our HMIS is for 90 days following, that CE assessor can re-enter that client's enrollment with one click of a button. So nothing will change. So they kind of actually have about 180 days before that assessment is not void, but like considered exited for good. As the CE manager, we do have the ability to enter those over 90 days, but at that point, we do ask that they complete a new assessment just to make sure their data is up to date and that we can best identify them for housing options. Regarding of if folks are ever turned away because that they did not score high enough or anything like that, no, that does not happen. As we mentioned, diversion assistance is available for all folks on the queue. So we do try to train our assessors on to know what intervention folks may be eligible for. And for those who do score lower, speak to them about options around either self-resolution or diversion, but they can still be on the housing queue. And they can receive those updated assessments every 6 months. Or as I mentioned, if things have changed, those will be updated. So no, we do not turn away folks from the housing queue.
We had a non-traditional question, which I love. What are the qualifications or requirements to become a mobile assessor, and who would you talk to? And Nikki says we could do this offline if this is not the right forum, which brings up a great point. We will include some of the contact information so that you can ask the team, these presenters, any direct questions if you want to, but we will include that in the follow-up email for everyone who attended or registered.
Yeah, I think this is a great question. If organizations are interested in becoming access points or specific folks within outreach teams or anyone becoming an assessor, they can reach out to me via email. We have an initial meeting just to discuss that further, what that looks like, the capacity needs of it. If an organization is not already utilizing HMIS, we would first get them in the HMIS system and set up either like a support services only or a street outreach project. And one requirement we have had is that folks operate within HMIS for 3 months before becoming a CE assessor. And that's just really necessary from kind of a data management standpoint. So that is something we have done. But otherwise, if there are existing street outreach teams in the community that want to be assessors, I think we are all for expanding that outreach and scope of CE.
We have one last question. Daniel asks, are those contacts tracked in HMIS or resolved at your weekly meetings? I assume that you know what they're talking about, but I can't remember what the context is for that question.
Daniel, I'm not sure if you're referencing just client contact in general, where I was stating that the CE assessors must maintain contact monthly, but folks add services within HMIS, so we can see those in the system, and that's how we track active status there. We also communicate in system navigation and other forms about that. When we did our housing queue cleanup that was mentioned last year, we did do lots of training and sent out lots of reports to agencies so they knew who was showing as active, who wasn't, and making sure they were getting those services updated so that no folks were mistakenly exited. And that was about a 3-month process of just really kind of monthly sending those reports and making sure folks were making client contact.
Wonderful. Thank you, Paisley, for fielding these questions. We had, I think that is all the questions we've had. We will go ahead and end the webinar here. Everyone, thank you so much for attending. This means a lot. Partners for Home and Institute for Community Alliances are 2 organizations that we rather admire here at Eccovia. And you know, we believe that connecting communities together to share their visions and their processes is essential to mitigating homelessness and improving social determinants of health for our most vulnerable neighbors in this country. So thank you all so much. And we will send the follow-up email either Friday or Monday with the webinar recording, the answers to your questions, and the slides with all the resources linked so that you can download those. Thank you so much, everyone, and have a wonderful weekend.